Hi everyone, good afternoon. Thank you for joining our first community of practice of 2026. We're trying to look at community of practice in a slightly different way. So we're not blocking your diary out for an hour and a half anymore. We're putting like 1 hour sessions in over lunch or early morning, so they hopefully don't clash with as many meetings as possible. And today we have Jeff Barnes and Vanessa here to talk about developing a food action plan for North East Lincolnshire. So I've got your slides when you're ready as well, Jeff. So I'll hand over to you to yeah.
Thank you. So I'm Jeff Barnes. I'm Deputy Director of Public Health, North East Links Council.
And I'm Vanessa Fair for Public Health Principal. I'm on mat leave at the minute, but this is a keeping in touch day. But I'm not back properly until the end of June.
Okay, so the context of this is that a couple of years ago, I think it was, a motion in North East Lincolnshire Council asked for the development of a food poverty action plan. And for one reason or another, it didn't happen immediately, and eventually the responsibility was passed over to Public Health a year or so ago. And as we said at the outset of this, what we really needed to do was understand the picture of food poverty in a wider context of the food issue more generally. And the way we wanted to go about this initially was to do a food poverty needs assessment, which Vanessa led between around February and June of last year. We will give you a summary of what came out of the food poverty needs assessment, and then we'll talk a little bit about what are the next stages, and the next stage is essentially moving on to develop a food plan. I'll say a little bit more about the context of that. We're not, I think, now going to be calling it a food poverty action plan because of some of the wider contextual issues of food in the area and links to the health and wellbeing strategy that came out in December. But essentially, it will include all the issues that came out of the food poverty needs assessment in the wider context of food health. So without further ado, I'll pass over to Vanessa to give the overview of the food poverty needs assessment, and then I'll come back a little bit later on, and then maybe we can then have a little bit of a discussion around some of the priorities we're going to talk about going forwards.
Yeah. Could you just go to the next slide, please, Amy? So, as Jeff mentioned, last year I led on a food poverty assessment, and I thought it was just useful first to kind of define how we define food poverty for the purposes of the assessment, because there's so many different definitions of food poverty out there. Traditionally, food poverty only really thought about food in terms of can you afford food, basically. Definitions in practice nowadays are a lot more broad and kind of more entwined with food insecurity, sort of with this recognition that actually what affects your access to food isn't just your finances, it's much wider than that. There's all sorts of kind of social, environmental factors that impact on your access to food. So the definition that we used for the purposes of the food poverty assessment was a household can be defined as experiencing food poverty if they cannot or are uncertain about whether they can acquire an adequate quality or sufficient quantity of food in socially acceptable ways. And for the food poverty, it's okay, you can go back to that slide, it's all right.
Sorry.
Yeah, and so for the purposes of the food poverty assessment, we took quite a broad methodology really to try and get lots of different sources of intelligence. So we did a focus group with North East Lincolnshire's Food Forum. For those that don't know, the Food Forum basically brings together community food providers, so food banks, food pantries, social supermarkets, and then wider support agencies, so agencies like Centre For, the council's homelessness team, the council's contact centre, Citizens Advice, Navigo, Lincolnshire Housing Partnership. And so we did a focus group with all of those agencies to understand their perspectives on the scale of food poverty locally, trends in food poverty, who's most at risk or most affected locally, and then also their perspectives as well on where support isn't working well. I also did a one-day census with We Are One Food Bank and We Are One Food Pantry, and that was to collect demographic data to understand the household composition of who was accessing emergency food provision. And then we collected data from a range of partner agencies as well. So data, for example, from Connect NEL, from Citizens Advice. And then I also looked at existing data and intelligence to understand residents' lived experience as well. So in July 2024, Healthwatch did some research talking to people using food banks in the area, which was really, really useful. Also, we've done the adolescent lifestyle survey in 2024 as well, which brought up some issues around kind of food as well. And then we looked at national data as well to understand the national picture and then how North East Lincolnshire compares to this. So after COVID, there were lots of different surveys done nationally around food poverty as well, which was really helpful for us. And then finally, we did a literature review to understand the best practice for combating food poverty, including the role of local authorities. The next slide, please, Amy. And as a really brief summary, kind of what we found from the assessment, firstly, was that there's increased demand for food support amongst older people in North East Lincolnshire. And a big kind of pressing factor with that was the rising cost of living. So we found from the one-day census that we have maybe more older people than you'd expect coming into the food bank and the food pantry. But a lot of those were citing basically the rising cost of living. National evidence shows for older people that often food can be very, very complex and much broader issues than just financial. So one of the recommendations which I'll come on to one of the recommendations I'll come on to as well is to kind of look at that in more depth. We also found that there's very likely unmet need amongst families with children in the area as well, because when we compared data from the one-day census with national data on food poverty, we found that there was a smaller proportion of households with children, and in particular single adult households with children using We Are One Food Bank than you would expect given national proportions. Obviously, the one-day census was only done with one of our food banks, but when we combined that evidence with data from the adolescent lifestyle survey, which highlighted that some young people were reporting basically not having food in the house, and then also with the kind of discussion with the food forum, which said that they think that some families are reluctant to go to a food bank due to stigma and not wanting to bring their children. When we combined all that together, it really suggested that actually we probably have unmet need locally with families with children. We also found that households from ethnic minority groups might be particularly vulnerable to food poverty locally as well. There were some limitations when over the one-day census because we asked an ethnicity question, but obviously I could only do the census with people who kind of spoke good enough English really to kind of understand the question. So there were quite a few people who didn't fill in the survey because they didn't speak good enough English, which will have skewed our ethnicity questions for that census. But we did find from that one-day census that there seems to be definitely, for example, need amongst asylum-seeking families in communities. We also found, and this was a really strong finding, that ill health and disability is impacting on food poverty. So almost 2/3 of the attendees at We Are One Food Bank and We Are One Food Pantry reported having a physical or mental health condition which had a significant impact on their day-to-day kind of tasks. And then citizens advice data as well from 24-25, that also showed that I think it was just over half of the people they'd supported in that financial year had either an illness or a disability as well. So that was a really strong finding as something which is impacting on food security locally. And then finally, we also found that there's challenges for households in relation to benefits, housing, and in particular debt, as well as challenges with addiction. So the feedback from the food forum was that addiction is a real pressing issue locally that impacts on people's access to food. Alcohol and gambling, but particularly alcohol, is a significant issue locally. And in the one-day census as well, some people did open up about their experiences with addiction and how that had impacted on their food access. Next slide, please, Amy. And kind of moving on as well to what we looked at, what works. So national evidence highlights that offering wraparound support to people experiencing food poverty can help to address the root causes of why a person or a household are experiencing difficulty. And when Healthwatch went into food banks in July 2024 and spoke to people, they also found that people value wraparound support as well. And then kind of the other big finding as well is that moving towards a model of food provision which provides a safety net for people experiencing food poverty, but also supports people to move back to mainstream food provision. That helps to reduce longer term reliance on food support, but it also promotes dignity and choice and control over food. So basically moving towards a model which is more like a food pantry where you maybe pay a small fee and get a food, basically a food shop, but you have the choice of what you kind of put in your basket rather than, this is what you've got available, here, have some bread, have some beans. And again, that was supported by Healthwatch's research talking to local people as well, because they found that there were better outcomes for people supported and also reduced food waste, where providers had a conversation with someone first to either understand, you know, kind of what their home environment was like and make sure that they could cook the food they were given and that it was familiar to them, or that there was better outcomes as well, where people had choice over what food they kind of took away from a food bank. Next slide, please, Amy. Two things which are important to mention, though, are that there were gaps in the data, and the big two being, firstly, that it's difficult to track trends over time in North East Lincolnshire in the use of emergency food provision, and that's for two reasons, really. One is that, unlike in other areas where a lot of the food banks are Trussell Trust, all of our food banks are independent, with the exception of We Are One, which links in with West Marsh Food Bank and Feed the Community. All of our kind of food providers are independent of each other, which means that it's impossible to track whether it's unique households using food banks, firstly. So we don't know whether, you know, the households using We Are One are also using Rock Foundation. We wouldn't be able to say that in the data. But also, whilst historically we did have a post who would kind of collect data from the food banks each week, and then we could look at the trends over time. A, not all the kind of community food providers filled in that survey, and B, there was a big gap in when data wasn't collected. So we don't currently have any data to say these are the number of unique households over time accessing emergency food and how that's changed. That's impossible to kind of say at the moment in North East Lincolnshire. And then the other kind of point as well is, oh sorry, I should just go back a slide, thank you, is that further work is needed to understand the frequency of attendance of food banks as well, and how long households are reliant on emergency food provision. And again, that's due to partly because the data is not linked between different providers, but also because there's a real variation locally with our food banks. So some of them are very small, volunteer run, where they collect all the data on paper forms, basically, where you just sign in and you say your name, how many people are in your household, your postcode. Whereas others are much bigger and they have like a formal membership system on a kind of like, you know, electronic system. So it's very difficult for some of the food banks to say, well, this is how frequently different households are using our food bank. This is how long they've been using our food bank for. So again, we don't have that kind of knowledge locally either about of the people using our emergency food provision, how long have they been using it for and how frequently. We can't currently say that either. Next slide, please, Amy. So on the back of all of this that I've talked about, the food poverty assessment made a series of recommendations, which I'll kind of run through quite quickly. But the first was to share learning from the West Marsh Food Bank wraparound support pilot with the community food providers in North East Lincolnshire, in order to inform funding bids and proposals for similar wraparound support offers elsewhere in the borough. So for those that don't know, this is basically a pilot of a centre for providing kind of a benefit and debt advisor who goes into West Marsh Food Bank with the kind of aim really of helping people with the wider issues, which kind of mean they're needing support with food. One thing I didn't mention, which the food poverty assessment made really clear, was for those using citizens advice support, quite often they might need help with food, but that was by no degree the only issue. It was very, very rare citizens advice or somebody where their only need was food. Normally it was a lot more complicated than that. Linked to what I was just saying about data, there was also a recommendation to work with community food providers to continue to capture data of who is experiencing food poverty and what their support needs are, to inform preventative strategies to reduce the duration and severity of food poverty. And that this could include all community food providers committing to running a one-day census or something similar each year. Work with support services to enhance the wraparound support offer for food banks, including a particular focus on support for debt, addiction, benefits and housing. Ensure that access to healthy food is a key consideration in local initiatives around work and health, and to engage with North East Lincolnshire's Food Forum around this agenda. So that was linked to the findings around disability and ill health and how that impacts on food security. And then also to conduct further work to understand access to food amongst older adults in North East Lincolnshire, with a view to understanding wider social and environmental factors which may be impacting on older people's food access. And that was in line of the national evidence I mentioned, that for older people often kind of food is quite a complex issue, affected by a lot more than just your finances, but by things like mobility, kind of the social aspect of food, etc. Next slide, please, Amy. And then we also recommended to ensure that nutrition and hydration is factored into the development of an ageing well strategy in North East Lincolnshire, to work with community food providers to enhance people's choice and control over their food choices, and that this should include consideration of culturally appropriate foods and exploration of alternative models of food provision in line with Feeding Britain's model of affordable food clubs. to work with the local substance use service, the local recovery community and community food providers to explore how the nutrition of people experiencing or recovering from addiction can be safeguarded, taking into account learning from the Feeding and Recovery Project. We said that further work is needed to understand food security amongst households with children in North East Lincolnshire, and that this should include conversations with local families to understand their experiences. Work with North East Lincolnshire's Food Forum to enhance data sharing between providers with a view to enhancing understanding of the scale of food poverty in North East Lincolnshire, understanding reliance on food banks. And then finally, to build on the council's role as a public health council to identify and promote best practices for supporting residents with debt, benefit and housing challenges. I think I should pause for any questions there.
Okay, yeah. So that was the food poverty needs assessment, which was completed in around June of last year. Before we'll have further opportunities for questions, discussion later, but before I move on to some of the what next sort of bit, it would be useful, I guess, to just pause to see whether anybody has any questions or comments they wish to make about the food poverty needs assessment specifically. Just pause for a moment. Hazel?
Hiya. Well, it's nice to hear your voice, Vanessa. I hope it's going well. I just wondered if it's if that needs assessment is on the council's data observatory website, Neldo.
Not as yet, Hazel. No, I think it's probably going to go on there in a few more weeks when it's fully signed off, and then we can get it on there. But yeah, it should be there soon.
Oh, good. Only because I just wanted to put a little link from the children's JSNA to it because I think it links in nicely with it. That was all.
Okay, I'll see if I can get it on there pretty quickly then. Yeah.
Thank you.
Amy?
I've just done the first quarter of the West Marsh Food Bank project and looked at the kind of like who we're supporting, what their needs are. So I will share that with you as well, Vanessa. But it's quite interesting. And I think one of the kind of comments that have come out of it is how do we kind of ensure that when people are using the food bank, it's to kind of with a view not to use it in the future and to slowly kind of like get less dependent on it, where I think some people are using it as part of their weekly provision and not thinking of that, how do I become more independent of a food bank? So I think that was one quite observation on that. But you know, the people that were helping on that project, they are all getting benefit support, they are all looking at a holistic approach. So yeah, and there are people, families, and I think the other kind of comment around that was fresh fruit or vegetables. Yes, there is, but it's kind of like your white breads and things like that, and not more of a whole grain or a healthier alternative, really, as well.
Yeah, and that's a good point, Amy. And the view going forwards, I think, in the area as a place is that food banks are not the solution. They are a sticking plaster to get us through a really difficult time. And the intention going forwards is to find ways to meet food security in a way that enables people with low incomes to access food in a way that perhaps doesn't come with some of the stigma that attending food banks does. We know from the needs assessment that there are plenty of people who are food insecure who do not access food banks because for a number of reasons, one of which being they feel there's a stigma attached to it. And therefore they go short or whatever. And that's an issue that we've really got to address in whatever we do going forwards.
And the other thing was it wasn't just food that was needed, it was things like hygiene packs for both male and female. And at the minute, that current provision isn't necessarily there at the food bank. And so Centre 4 have been amazing and provided those things as part of that support. But actually, it's not necessarily food that people are always coming there for, it's other elements as well.
Anything else on the needs assessment anybody wants to say? If not, can you bring the thing back on the point we stopped for this, Amy, please? Okay, next one. Okay, so where are we now? So it's been a long-standing demand from elected members in the council that we needed a food poverty action plan, and we are going to deliver a plan by summer 2026. It needs to align very much with the Marmot principles and the new health and wellbeing strategy that were signed off in council in December 2025. For those of you who don't know what Marmot principles are, I'm sure the majority of you do, but really Marmot principles is about a focus on early years and children, focus on standard of living for everybody, integration with environmental and community type issues, addressing things like racism and discrimination, and looking at a sustainable health system going forwards. And North East Lincolnshire Council is now building those principles into all its policies. All its reports have to address Marmot principles, and therefore it has the potential to be a really transformational way that the council will operate into the future. Very much in line with the new health and wellbeing strategy. And if you haven't had a look at that, then please do. And I think maybe it might be good to bring that into a future one of these meetings specifically as well, because again, it's quite a transformational document for the future. We took the food poverty needs assessment through various meetings in the summer and autumn in the democratic process, and lots of support. Very little disagreement with anything in there, including with the recommendations, but a view that it needed to be strengthened into something a bit bigger than just a food poverty needs assessment, and that's kind of what we're going to try and do over the next few months. We know that we have a big issue of weight. The country does at large, but NEL has additional challenges to those. For instance, data coming out at the end of last year had us as the highest in the whole of England for overweight in reception year children. We have 70% plus of adults who are overweight. A real population health-wide issue. And whilst things are a little bit worse in deprived areas, they are pretty bad just about everywhere. And so we need to address the thing as a whole. There is a healthy weight strategy under development as well, which will be very much aligned to the food plan. And the healthy weight strategy will be finalised probably after the food plan comes out. So if you move on to the next slide, Amy, please. So based out of those initial consultations, we've kind of knocked up these 10 priorities, that all the recommendations from the needs assessment will hopefully fall under one or other of them, but there will be others as we develop an action plan to these. Just quickly to go through them one by one. Firstly, expand access to fresh food. We know that processed food is a big issue in terms of overweight, obesity. If people can eat fresh food, they are much less likely to suffer from overweight. So we're looking to support local initiatives that bring fresh produce to underserved areas through things like mobile markets, community allotments, farmers markets, etc. Some of the detail to be worked out. And we know that the more deprived communities have much less access, by and large, to fresh food than some of the more affluent communities, and particularly those who are income challenged as well. NEL is marketed nationally as the food town. We have an enormous seafood industry. We have farming partnerships nearby, and we want to find a way of bringing those kind of things together to linking with the whole economic strategy. So looking about how we develop seafood and local farming partnerships, collaboration with the seafood manufacturers to supply healthy and locally sourced food to things like schools, food hubs, which may be what we call food banks in the future, and community organisations. We want to work with all the local community food providers to partner with them work with the voluntary sector, etc., to increase access to healthy and affordable and culturally appropriate food, whilst very much focused also on issues of financial resilience, which underpins the whole food poverty issue in a big way. Many of the issues that came out of the needs assessment showed it's not just the unaffordability of food, it's the fact people are in debt due to high rents, high energy costs, gambling debts, whatever really is really driving up people's needs for food support. Community food hubs and food banks, so try and support them to access much more healthy, fresh food rather than an over-dependence on processed food. Currently, they can access fresh food, but it's often the stuff that the supermarket have available at the end of the day or whatever that they haven't been able to sell, and whether it's always the freshest, it may be questionable as well. We need to find ways of getting more of that fresh food into the food hubs going forwards. We need to develop local partnerships to combat food deserts, working with the retailers, the private sector and the community sector to encourage availability of affordable fresh foods in small local convenience stores, particularly in areas of difficult access. We know that nutrition is a big issue in schools. Things have got a little bit better maybe in the last 10 years, but still there's a long way to go around what we can do in the school environment to build better understanding of food health, and within voluntary sector organisations, how to access healthier meals, how to cook in a way that would produce healthier meals. What can we do through local community centres and food banks, etc. There's much more that we can definitely do. Policy advocacy for food environment improvements. So that's advocating within the local authority, for instance, within regional economic forums and nationally for things that we can do to limit proliferation of fast food. Again, we know the greatest density of fast food is in areas of income insecurity and low income and poverty. And we've got to do more to address that going forwards. Communications, I think, is a big issue to raise the profile of healthy food and to combat food poverty. And again, we've had initial conversations with some of our comms in the council about how we could really ramp up comms information to sort of do old-fashioned health education about some of the what is healthy and what isn't healthy. There's a lot of lack of understanding about that in relation to food. Disabilities, it came out as a strong issue. Food intolerances, diabetes, all those kind of things, which can make food more expensive for people or difficult to access. And that's another area that we think should be a priority. And finally, amongst these draft priorities is around the whole intelligence issue. Vanessa did a fantastic job in leading that needs assessment, but often it was really difficult to get information from the food banks, and we ended up doing things like food censuses because of that lack of information. And if we could ramp up some of that, I think going forwards we'd be in a much stronger place. So they are the draft priorities. As I say, they link very much, many of those mirror things that are in the health and wellbeing strategy as well, to really ensure that the things are joined up. They are by no means finalised. I would be very surprised if all 10 of those are in the final plan. Some of them may be merged or whatever. Some of them may be taken out. And I would strongly suspect there will be a few additions as well as we go through various consultations over the next month, 6 weeks or so. And today is the first opportunity, I think, for those of you who are on this call to potentially influence some of that. So if you go on to the next, Amy. So, I mean, we haven't got that long. We've got another 25 minutes or so. And I also want to bring in a colleague from Sustain briefly as well after I finish talking. But these are the questions I'd like people here to consider. You can respond today, or you can respond after today. And I'll leave our contact information on at the end. But essentially, these are 6 of the key questions. How do the issues identified in the food poverty assessment relate or not to what those of you who work in this area see in your everyday practice? Is there a particular vision you think should be kind of the overall vision for the food action plan? How can we involve local people in the development of food action plan? We've got a few ideas. We're going to probably do a community survey, for instance, and do a number of activities with the voluntary sector. But is there anything more that we should be doing? How do you feel about the draft priorities that have been identified? Is there anything that jumps out to you immediately that you think, yes, that's the top 1 or 2 or whatever? And then what do you think is missing from those priorities? And finally, anybody else that you think that we need to consult as we go forward. So we'll come back to that slide in a minute when I throw it open, but if you just want to skip on to the next, Amy. So in terms of what next, so as I say, we've got a few consultation events. So for instance, we're doing one with elected members, we're doing one hopefully with children's health people, we're going to be doing one with council staff, we're going to get one organised for the voluntary sector, we're going to do a community survey, and there are other potential things as well. We want the priorities to be agreed by March. That's the kind of top level priorities, and then underneath that, develop an action plan by April, which will incorporate the recommendations from the needs assessment. And then we then have to take it all through the council's democratic processes, which can take a little while, but the aim is to have that done by around June. And I think that's the last slide, was it, Amy? Oh yeah, just my contact details. If you want to write after this meeting, make any suggestions or challenge anything that we've said, then feel free to write if you don't want to say anything directly in the meeting. So just take that down, Amy, please, now. Okay. So before we open it up,
you've had a question in the chat from
okay.
Kat asking if the slide will be shared.
Yes, absolutely. Yeah. I'm happy for you, Amy, to share it with everybody after this. Yeah. It's great. Right. Okay, I'm just going to invite Simon, who's on the call. We're going to be partnering a little bit with the national food charity Sustain, who have done lots and lots of work with councils around England or Britain on these kind of plans, that they bring a lot of external expertise. They'll hopefully provide some insight and maybe a bit of challenge over the next few weeks as we do this. But I just want to bring Simon in just to say a few words from the Sustain point of view and about how they're going to be assisting.
Thanks, Jeff. Hi, everybody. So yes, I've been working in and around food poverty, wider food access issues for at least 15 years, I think. And so myself and Isabel, who's based at Sustain, I'm freelance on this project. We're going to be supporting the development as needed. And yeah, I've sort of predominantly worked around what have been called food poverty action plans, but some of them do evolve into food access plans, food equity plans, good food plans, good food for all plans. Like, it's very much obviously up to you locally to decide that scope and what you call it. And I think to actually turn it into something a bit more positive, like food action or food equality, food access, rather than food poverty, sort of emphasizing the problem rather than the solutions, is a good way to go. And I guess food poverty action plans and different kinds of plans have been particularly in development for the last 10 to 15 years or so, sort of alongside the rise in food banks around the UK. Actually, lots of councils and voluntary sector organisations actually were worried about that rise in the sticking plaster, as Jeff said, of food banks, while obviously recognising that they're a very humanitarian and unfortunately needed response at the moment. So what we've seen is that action plans, it can be, it can feel like, quite a lot of work, there needs to be a lot of evidence gathered, these sort of conversations. But I guess just to encourage that it is worth doing, because we have seen where plans have been developed and then reviewed and renewed over the last 10 to 15 years. It can be a really good way to join up action across the public and voluntary sector and sort of the private sector in terms of particularly the food, agriculture, seafood sectors. I think that's a really interesting opportunity you have locally. And to develop some, to think about the responses that are locally, to sustain them, to actually sort of, I guess, level up responses, as people were saying, around moving away from the sort of strict food bank model to more dignified food projects and food access projects, and to kind of that can feel like really challenging for one project to turn from a food bank into something else. But actually, if they're doing it together as part of a wider plan with support from partners, it all becomes more doable in some cases. And I think also people have mentioned some specific groups as well. I think a plan can really help identify actually, yes, access for older people, access for families with young children, access for people who are perhaps recent migrants, recent arrivals. Individual projects might be noticing a bit, but actually, as your work has done to identify some needs across the area, a plan could then kind of do something with that in the way that individual projects might struggle to take action around specific groups. And I think some of the best plans are relatively short, if I'm honest, relatively concise. Initially, yes, they might be a Word document, but I think it's always worth investing a little bit in how they're presented to try and get that buy-in. Some develop a kind of pledge, a sort of charter that partners can sign up to, so just to foster a bit of shared sense of responsibility and ownership. And I think, yes, where I think food is obviously a really interesting issue, and I would say that having from where I've worked, but it can be the way to access all sorts of things around obesity, around household income, around loneliness, community, equity, inclusion, and diversity. And so I think, yeah, a plan that is a bit more than a food poverty action plan is a food plan for the area can really help to draw some of the dots between different strategies, different agendas, and really, I think, make that quite attractive as well to people, whether that's elected members or senior management or projects and people. Actually, food can be a great way to bring some energy and thinking about food. And it's a slightly specific point, but I'll just share in the chat in case people aren't aware, the government's just published the guidance for the Crisis and Resilience Fund that is the new version of local welfare support in England, and it will cover the next 3 years from April. And there's quite a lot in that around cash first responses, so recognising to get as much money as possible in people's pockets, but also how to support sustainable food responses. And it's broadly been welcomed and seen as a positive development, partly because it's 3 years rather than a hodgepodge annual announcement of funding, and the sort of the organisations wanting to change food aid for the better and move away from the sticking plaster models that have broadly welcomed it. So I think it's worth having a look at that as well and seeing how that will affect and link in with the plan, which I know is already on various people who are involved in developing the plan's agenda. So I'll stop there, but just to say myself and Isabel will be dropping into different meetings. Hopefully we'll be coming up at some point as well. So hopefully see you again in some form after today as well.
Thanks, Simon. And just to say, I think in my head anyway, what will be the final output or whatever of this will be a fairly dry action plan full of words and what have you, but then a much more public-facing document, which will be shorter and colourful and much more accessible, I think, to the wider public, with the aim of getting wide engagement, wide interest, working with the media, working with social media, whatever, to try and do something transformational around food, because it is desperately needed for the healthy weight issues that we've talked about. So thank you for that, Simon. Just before we kind of open it up more widely, I'm just going to try and respond to some of the comments I've seen that have come through. So there's a comment around the work from Sarah around the work with the food sector. So yes, that's new. I did work during the COVID days. I remember having conversations with managers of fish factories who at the time commented, that they wanted to be part much more of the health issue going forwards. And then We've had conversations with the Assistant Director for Economic Development in the local authority, Damien, and he's really keen to take this forward as a kind of forum initially with local food providers. I think it will be it'll take a while. It's not something that's going to happen overnight, but when you work with the private sector, you've got to find opportunities for making it worth their while. And I think from the conversations I've had with Damien, developing some key actions around how we will work together with the big fish factories locally to get more of their produce into local schools, for instance, or into local shops, will be the way forward. But any suggestions for how that, if anybody has those connections who are on today, then please let us know. I think this is a big opportunity, but as we develop the actions under that priority, there's stuff for us to learn as well. Planning, yes, planning is absolutely key. Planners are very much on side with this. We're already developing new policies around where takeaways can be placed. We're in the midst of the development of the new local plan, which will be much more of a health and wellbeing plan than ever before, about things like access to community facilities, ensuring warehouses are built that are community facilities, ensuring things like active travel is built into all new developments, ensuring access to healthy food is considered in the process as well. So all part of the Marmot agenda going forwards. Turning our planning department as best we can into a public health planning department is kind of the vision there. Katrina's talked about co-production. Members of the community have used food banks as included as part of the when making decisions. Yeah, now we're looking at the best ways to bring people who've been accessing food banks. Obviously, they were part of Vanessa's work and the needs assessment, but yes, building them into the action plan as well is an absolute must. I would say. And something about developing, sharing food and culture and promoting community cohesion. Yeah, that's a very topical one, because the director here, Diane Lee, is leading a community cohesion strategy for the council over the next few months. And again, yeah, looking for ways to align the food issue into that will be key. And the crisis and resilience fund. So yes, we work with one of our council colleagues on funding in relation to food issues, the household support grant and food and the crisis fund, etc. So all of those are very much on our thought processes as we go through these next few weeks. And will be built into the consultation and hopefully into the plan as we develop. So can I open it up then, just on that issue, on those questions that I put on the screen? Do you want to just remind us, Amy, what those questions were, and then I'll invite questions.
I was just going to say as well, and the question or the comment that Kat put in about the now we've had Michelle at the West Marsh Food Bank for 3 months. Could she be part of that? Because she's building some brilliant insight into what happens there, how they reach out, where they work. And I think her insight included in that would be really useful for you.
So, I mean, I don't know whether she will be included or not, but one of the consultation events that has been set up in February is with the food banks, food pantries, etc. So if she's part of the food forum, she will already have that invite. If she's not part of the food forum, then if you let me know, I'll make sure she gets included in that invite.
Excellent, thanks, Jeff.
Okay, so reminding you those questions, and again, if you don't wish to say anything here or think of something later, then please do respond. But I think we've got about 10 more minutes, so there is a bit of an opportunity to contribute. So how do the issues identified in the food poverty assessment relate to what you see in your everyday practice? Anything about vision of the plan perhaps early days on that, but eventually we want an overall kind of vision. Best, we've had some suggestions about involving local people, but if there's any others, any more thoughts about the priorities, those that are in there, those that are missing, etc. Anything about consultation. So don't be shy if there's any thoughts that you have now. Now would be a good opportunity, I think, to share those with Vanessa and me and the rest of the attendees. So please do stick your hand up if you've anything you want to say. Katrina?
Sorry, didn't unmute quick enough. Hi, it was with respect to what I've said, and I appreciate that you're planning some consultation events, but I did wonder about the maybe developing a working group, because obviously you're going to get all this response through your consultation. And if you had a reference group or a working group that involved members of the community, sitting side by side with obviously council workers, then you've got the voice of lived experience sort of going through it as well. So when you get all your consultation results, you've got a person with lived experience that can maybe add a little bit more colour to the black and white when you're going through it and deciding the priorities and the actions. So that would be my suggestion.
Thank you. Yeah, no. One of our colleagues, Claire, is making a note of anything that anything suggested. So, Claire, please make a note of that, and we'll feed it into the steering group. Simon, is that something that's happened in other food poverty assessments?
Yeah, to have a group of people with lived experience who have sort of followed the process throughout, and it is always challenging when you've got quite a limited timeline as we have for this bit of work. But yeah, it's certainly something we would say is important, obviously, in terms of doing stuff with people when they are going to be the beneficiaries of it, hopefully. And I think we certainly found those conversations really helpful in terms of bringing some different perspectives and some challenges and thinking differently, I suppose, and not seeing things from the organization or the service or the sometimes quite siloed perspective that we can all have as professionals. So it has worked, but it does require obviously support and work to do it well and for people to feel like they are having a say, etc.
Thanks, Simon.
And we've got some examples we can share of that as well.
Yeah, that'd be great. Thank you. Rachel?
Thanks, Jeff. Yeah, I just want to highlight the point that the production of this assessment and this plan, that's not just it. It's going to be continually reviewed. So as things change locally, as things change nationally, the plans, going forward will be updated to reflect kind of new stuff. So although maybe not every priority will kind of make the final plan this time round, as things change, as to those priorities may well change and come back, or new ones hit, to make sure that it's fully reflecting the situation as it stands at the time.
Yeah, no, for sure. I mean, the aim of something transformational is it will go on being shaped, and where the food and weight agenda is concerned, the issues have been half a century in the making. They are going to be many, many years in the solving. And food is so integral to everybody's life, really, that it is, now we've got really on top of the smoking issue. This is the big public health issue of the future: food and healthy weight. So yeah, no, this will be developed and shaped over time. But what we need is something to invigorate action, I think, in the short term. I just noticed, Lauren, you're not going to like me, a comment you made in the chat there, and I completely agree. Which is, I think our community should shape the vision. Totally agree. But how do you think we should have them shape the vision?
Oh, you have put me on the spot, and I came in halfway, well, towards the end of your plan as well. So
Sorry,
I digested it all. Sorry, yes, I was in some training up until 12:30 actually on systems leadership, which was talking about community asset mapping, and it's really invigorated me, I think, in terms of how we use those hidden assets within the community to do some of this. So just take Centre 4 as an example. They hold their lunchtime clubs, don't they? There with the provision, and I think it's about going into the community, and I think Amy and Kat would agree, to where they're at to start having those discussions, or if we know people already in the community that they already trust, that they have the conversations on your behalf in terms of some of that. I can see some sorts of workshops or activities or something that happening, but obviously you need capacity behind that and the time to do that. So yeah, it just needs a little thought, I think. So sorry, that's not a full answer, but
No. It's very helpful. Thank you. Yeah, no. And as you say, yes, it needs a lot of thought, really, because there are within the one community, there are many communities, not just communities of geography, but communities of interest, and it is a very complex environment to get to grips with. But really important as we go forward with this agenda that we do understand the different communities and the different needs that are out there.
Yeah, absolutely agree.
Okay, any other comments? Questions anybody wants to feed?
I think you've got a hand up, Jeff.
Oh, have I?
Is it Hazel?
It's
Hazel?
me. Yeah.
Oh, Hazel,
I was just going to say that we're doing some focus groups with young people after the adolescent lifestyle survey. We decided on a couple of themes that we wanted to dig deeper, and one of them was around being healthy. So not just food, but activity as well. We did. I didn't personally do it, but we did one on Tuesday. Actually, it went really well. Once we've done those, if any key themes come out that could, inform this, I'll obviously share with you and Vanessa. But yeah, so one of the themes was around being healthy, and like Vanessa will have already mentioned that things like young people wanting to be healthy or nutrition being taught in schools, and things like that were part of the adolescent lifestyle survey. So hopefully some of those bits will come out. So I know it's only one tiny part of the whole picture, but yeah, that might tick part of the box of the what people saying and what the community is saying, at least. And I suppose already you have got the adolescent lifestyle survey in there that was asking 6,000 young people what they think, and there was a big section around food in there. So I know we haven't asked adults, but we have asked young people, and that has been included in the whole work that's been done. So just wanted to add that.
That's really how I wasn't aware that those focus groups were underway. When will they be completed?
I don't know yet. So yeah, one of them, the first one, it was like we did it as a tiny bit of a pilot just to see how it would go, and it did go really well. So definitely going to try and get a few more done. So it'll just be James Steer trying to get in with some of the schools. And I think Ross Blackwood's got a contact at Franklin, so hopefully we'll be able to do one there as well. So yeah, hopefully not too long. It's just a case of getting in with the schools and them having a group ready to go. So yeah, it has been talked about, and hopefully there won't be a problem with that.
Okay, thanks, Hazel. That's really helpful. Yeah. Okay. Don't see any more hands up. So just noting the further comments in the chat. Yes, youth workers, care leavers, etc. The children's focus is definitely built into the consultation and young people. So we'll try and develop that to extend to things like care leavers, etc. And yes, the community plans, for those of you who don't know, we've been working on community plans in the most deprived wards, so that there's a community plan for East Marsh, one in development in West Marsh, and will be in Sydney, Sussex and South wards as well. And yes, this kind of issue, it would be great if they could be included within the community plans in those areas. Absolutely. So that's something for us on the population health group going forwards, that we can look to work with you on that. Okay, Amy, is there anything that you wanted to say to wrap up? Or?
Just thank you for your time. Thank you for sharing all this insight and the work that's been going on. And like I say, what I will do, I download this, I'll put it on our YouTube channel, I'll share the link, then people can access it if they couldn't make the meeting, or to share, Jeff, for yourself and Vanessa, or to look back on. But yeah, thank you. And our next community of practice is in February, and it will be Adam and Sarah talking about the National Neighbourhood Implementation Plan, which is really moving forward now, and it's quite exciting. So that's been sent out to people's diaries, and if people do want to come that haven't got that link, just let me know. So thanks very much.
Okay,
Right.
thanks everyone.
Thanks.
And have a good rest of your day.
Thanks, see you all soon. Goodbye.
Bye, thanks.